Welcome to the Cass Health Podcast, the show where we hope to connect our community with healthcare information that's relatable, understandable, and useful to your life, and where you get to know better the neighbors providing your care here. I'm your host, Ann McCurdy, and I'm joined today by
Kat Neiman
and our guest,
Beth Olsen.
And today's episode, we are talking about National Nutrition Month. Before we get started, two quick disclaimers. First, the comments in this podcast do not necessarily reflect the views of Cass Health. And second, the information in this podcast is not intended to be construed as personal medical advice. Always consult your primary care provider with your questions and concerns regarding your health. Welcome, and thanks for making time to talk to us today.
Absolutely. Thanks for having me, girls.
So we've got some rapid-fire questions so we can find out a little bit about who you are. So, to start from, Beth, where are you from?
I grew up in Emerson, Iowa, which is about, just short of an hour southwest of Atlantic. So, not too far from here.
And your favorite sports team?
Well, I'd have to say the Cyclones. Absolutely. That's where all my money went. So, definitely. Go State.
Go State. Excellent. So, talking with our dietitian, if you're cooking dinner to impress, what are you making?
It probably depends who I'm cooking for, but I think an easy meal that everybody loves is something like a big pan of lasagna with some garlic bread, some sort of a veggie, and then some sort of a homemade dessert. So that's something easy to cook for big crowds. So probably something like that. That's always a family favorite.
It sounds delicious.
Yes, it does.
All right. If you had $50 to spend at Bonison's, yeah, you can buy whatever you want at Bonison's. Here's $50.
$50.
Kid in a candy store, what do you go and do?
Well, I was going to say, can the dietitian say candy? Because when I was growing up, my grandma had a store kind of like a Bonison's, and so we'd go and visit her a couple times a year, and I remember always going to the bulk candy section and picking out things that I only got a couple times a year. So I'm kind of like a kid in a candy store when I go there, and I like to see what they have. But otherwise, they just have lots of really fun crafts, and so I'd probably get something for my kids to do some sort of a cool craft on the weekend or something.
Awesome. Good answer. Favorite holiday?
I really like Christmas. Well, we have 4 little kids, so they're starting to get into the whole Christmas magic and spirit of things. So that's really fun. Or maybe Thanksgiving, if I had to pick a second one.
Excellent. Both good choices. I think about Christmas and I think about your caramels.
Yes.
I
know. So I kind of got myself into a pinch there because I'm known for that now. And so people are like, but where are the caramels? And so they're a labor of love. They take a lot of time, but I know people, they just really, really love them. So, yeah.
Well, they're one of mine. So
yeah,
I'm glad you make
too.
them. What will we never catch you doing?
I hate anything like creepy crawly snakes, spiders, bugs, worms. Like, I'm not going to touch a fish if I catch it. I'm kind of a girly girl in that aspect. But it's a good thing I have 3 boys because they're like, whatever, Mom, I'll help you.
Yeah.
So.
Okay, and what's better, the book or the movie?
I have 4 kids that are 5 and younger, so I don't have time to read books
either
or watch movies. Because if I did start a movie, I'd probably fall asleep. So I do listen to a lot of audiobooks, though. But I don't know. I like a good book, but like I said, just in this phase of life, it's hard. Yeah. I do a lot of audiobooks, though, thanks to our Atlantic library. I have the Hoopla app, and I'm always listening to different ones. So.
Yeah, excellent.
Well, I do dishes and laundry and, that kind of good stuff.
Any stupid human tricks?
I don't have a lot of tricks up my sleeve, guys, but I am left-handed. And so when I was a kid and, you're learning to play sports in middle school or whatever, and it happened to be volleyball, and the coach lined us up and they're like, okay, is there anybody left-handed? And it was very clear that anybody left-handed was going to be singled out and to go to another side of the gym to learn volleyball left-handed, right? And so I step forward and nobody else steps forward. And so before anybody could see me, I stepped back really quick. And so to this day, I cannot play volleyball left-handed, even though I play every other single sport lefth-handed, guys. So like basketball, softball,
and if you batted, would you bat right or left?
I bat left-handed, right?
Okay, okay.
Yeah. So, and I don't golf, but I have golf clubs that are left-handed, but I can't play volleyball left-handed to save my life. But it was always kind of a trick with other schools because they're like, oh, here's that Beth girl, she's left-handed. We know that from basketball, and so they'd go up and they'd block the left side, but then I'd hit with my right hand. So the first couple points it was kind of an easy score because I was a hitter, but then they'd learned that no, she just doesn't know how to use her left hand. So it's fine, but it was only volleyball because I didn't want to have to be the only kid that had to be singled out with the coach.
Singled out.
Yep.
All right, and how about childhood nickname?
So, a small town, right? So everybody knows everybody, and I have an older brother and an older sister, but everybody called my brother Mabes. Our last name is Mayberry. I've obviously since married, but so everybody called my brother Mabes, and I think they probably still do. And so naturally, as the younger sister, you kind of, you get that too. And it was cool because I'm like, oh, they're calling me my brother's kind of nickname, right? So I'm cool. I'm with the upperclassmen here, and so I was B Mabes for Beth Mayberry, and so I think I had that screen printed on the back of every high school hoodie and basketball warm-up shirt, because it was really cool. And it's funny because a couple of his friends still will say B-Mabes when they see me. So that's one that's kind of stuck.
B-Mabes.
B-Mabes.
So. All right, and last rapid-fire question for you. Your next or your dream travel destination?
Next travel destinations, right, not a thing with small children. not an immediate thing, but travel destination. I'd really love to go see some of the national parks. I just love to see kind of like God's creation and the wonders of, the world. My parents do a lot of that, and I see their pictures, and I'm always just so jealous. So I'd love to do that, and I think like the first one would be like Grand Canyon and everything over there. So when I get to travel, and I want to take the kiddos with us too, but I'd say national parks.
Same. Mm-hmm. Utah. Yeah. I would like to see some of the national parks in Utah.
Yes. Grand Tetons.
Yep.
And we go to Lanesboro a lot in Minnesota, and so we haul our bikes up there, and we like to be active when we are on vacation, whether we're hiking or biking or doing something. But yeah, so something where we can be out in the great outdoors.
So let's talk a little bit about your positions here at Cass Health. So you have a little bit of a dual role.
I do.
Director of Public Health and dietitian. So let's talk a little bit about your dietitian side first. So what made you decide to be a dietitian?
Yeah, so actually my mom is a dietitian, so I'm like second generation dietitian. She has since retired and is in like full-time grandma spoiling mode unless she's traveling in, the beautiful parts of, the country, so in some national parks. So anyway, I just saw from a really early age what nutrition could do for your body. My grandparents had several different illnesses, diabetes, cancers, and just other health complications that nutrition played a role in how they felt and how they did throughout treatments or how they did managing a certain disease that they'd been diagnosed with. And so I always thought that was really cool. And then also, as a student athlete, I saw from a young age how nutrition could fuel or hurt your performance, whether in school or on the floor. And, I distinctly remember when we were in high school and you'd go to somebody's house before and have, kind of a pregame meal, and my mom, had it very thought out, and, as a dietitian would, like, what's the fuel they need to perform, right? And so we had all the right stuff, but not too much of it, but, stuff that was going to give us kind of that lasting energy to play. And we would play better those nights when, when we would be fueled well before the game. And then, there would be other games where some of my friends would drive to the town over and they'd go through the fast food line and they'd be like sluggish on the floor. They'd be throwing up at halftime in the locker room. They just couldn't handle it because they didn't fuel their body well. And so I just learned from a really young age how nutrition impacted us. And so I never thought of being a dietitian. Honestly, it was my senior year, and it was like, and that's just kind of the way I roll. It's like I woke up and I was like, hey, Mom, I'm going to be a dietitian. And she was like caught off guard making like lunches in the kitchen or something. And she's like, what?
You just like woke up and you were like, you know what?
Yeah. And
let me make this lifelong decision. Right, just like that.
That's exactly how it was. At least that's how I remembered. I should ask her. But I honestly, since the fourth grade, I wanted to be an architect, which is just hysterical because I have no talents or abilities in my life to be an architect. But even on those like little about me drawings, I'm like, I'm going to be an architect. I was like, how did I even know what that was in fourth grade? But anyway,
it sounded
so
cool,
my whole life, I'm like, I'm going to be an architect. And then I'm like, you know what, Mom, I'm going to be a dietitian. And she was like, Okay. And so anyway, we went to Iowa State, has both the College of Design, so the architect path, and then they've got College of Human Sciences, which would be the dietitian or the dietetics path. And so she's like, let's go on a campus tour and get a feel for it, right? That like you said, Ann, that's a pretty big life decision.
Yeah.
So we went and I toured both colleges. And before we left Ames, I was like, so I'm gonna be the dietitian, Mom. I told you, like, I'm doing this. And I guess I never looked back. So went to Iowa State for all of my schooling next. So
tell me more about Iowa State. So what does it take to become a dietitian? Like, what kind of education and training do you need?
Yeah, so you have to go to an accredited school. So Iowa State's one of those. There's, of course, others. But if in the state of Iowa, many individuals that want to be a dietitian go to Iowa State University. So you can't just go anywhere to do it. It's a very specific curriculum that you're trained in throughout your undergrad. And actually, by 2024, I think it is, you have to have a master's to be a dietitian. So I happened to stay for my master's when I was in Ames. So I did my undergraduate and I stayed for my master's. At the time, I wouldn't have had to. I'm really glad and thankful I did because it lined me up well for the position I'm in now, as well as like every other dietitian coming up behind me is going to have a master's too, right? So, but after you complete your undergrad, then you have to apply for an internship. And they're really pretty limited. At least they were, gosh, I think it's a decade ago, guys. That makes me. Only about 50% of the people that applied for them actually got one. So after I did my, undergraduate, then my master's at Iowa State, I of course, why not do your internship with Iowa State too, right? Like I said, just put all your money in one spot.
Do it all.
So I did the Iowa State dietetic internship, and it's 1,200 of supervised practice hours. And so basically you're working under different dietitians in different roles, and you rotate in areas of community nutrition, clinical nutrition, and then food service management. And so after you complete those 1,200 hours, you're eligible for the Commission on Dietetic Registration exam. So we call it CDR exam. So basically it's your boards, right? And you take your boards. Once you pass, you're considered a registered dietitian. But then it depends what state you're practicing in because every state's a little different. So in the state of Iowa, you also have to be a licensed dietitian. And so if you've ever seen my signature, it says MS for master's and then Master's of Science and then RD because I'm a registered dietitian and then LD is the licensed dietitian. So if you've ever seen a dietitian in like Omaha, for example, that's Nebraska. So they're registered dietitians, but they have LMNT, which is licensed medical nutrition therapist. So just kind of a little different wording for the same thing. And then, of course, we have to keep up our continuing education credits, and we have to put together a work plan of, where am I going to be in the next 5-10 years, and how am I going to make sure my education is going in that direction and staying up with what's evidence-based. So that's a little bit of how you become a dietitian.
So, and you hear the word nutritionist thrown around a lot, right? So can you explain the difference between a registered dietitian / licensed dietitian and a nutritionist?
Yeah, so some dietitians do call themselves nutritionists just because I think dietitian, that term isn't always, people don't always know what it means. But a dietitian has all of that schooling that I just mentioned, and as well as has continuing education requirements. Anyone on the street can call themselves a nutritionist. So, if I'm, just this random person who has an interest in, healthy eating or, a certain diet, I could say, oh, I'm a nutritionist. Let me teach you about that. There's no licensure for that. There's no credentialing. There's nothing to prove that they are who they say they are or that they've had the schooling to call themselves that. So that's really what sets it, a registered dietitian apart from, just a quote nutritionist.
Okay. And then you have your dual role here, right? So dietitian and public health. So tell us a little bit about the other side of the house.
Yeah.
Tell us about public health and how your skills as a dietitian have translated into that role.
Yeah, so actually it's been a really natural fit for me. So I always enjoyed more the community nutrition side when I did my internship. And when I was first practicing as a dietitian, I was more out in the community. And so I've been the director of public health for Cass County for about 5.5 years now, which seems crazy that I've been here that long. It seems like it wasn't that long ago.
I measure it in terms of how old Elsie is.
Yeah. Yep. Exactly. Yep. Exactly. Because I started just 2 months before she was born. So But so I've been director of public health for 5.5 years. Typically that role is filled more by a nurse. At least it always has like traditionally been a nurse. But, my background as a dietitian and then having that master's degree set me up really well for that position. And really large public health agencies have dietitians on staff. So that's not uncommon because they'll be out doing community nutrition or cooking classes or doing programs in schools. But in the state of Iowa, there was never a dietitian in the director or the administrator role. So I think that was kind of cool that I was one of the first, and I was kind of like leading a new way for a new career path for dietitians in the state of Iowa and showing, we can do this. We are set up so well for this with what we learn in our education in school. And since I've been in this role, I know there's at least one other dietitian that covers a county public health agency as their administrator as well. But, as dietitians, you learn how to budget, right? But from a food service management perspective, you learn how to manage people. You learn how to write grants. Being a dietitian is learning how to individually tailor the needs to the audience that you're serving. So a lot of those things that I do as a dietitian, I'm doing now, but just on a wider county level. So I manage multiple budgets. I manage different grants. I write the grants. I manage my staff. I manage different programs. And so it just was a really natural fit for a dietitian to slide into that role. And, we're still, we look at the community needs on a broad scope and, okay, so what does the community need? And how can we impact that to make the biggest difference for their health, right? But just health on a much broader scope than just from a nutrition aspect. So it's a really natural fit. And then 2 years ago, when the hospital dietitian retired, I kind of slid into that dual role. Like I said, I've always been the registered dietitian, so it was just a natural fit. And since our public health agency is, a hospital-based county public health, I was already a hospital employee. There was the opening, so it made sense to be able to do both roles.
March is National Nutrition Month, and so we get to talk to you about food. Who doesn't want to talk about food?
Amen.
So, just real quickly, tell us about National Nutrition Month.
Sure. So National Nutrition Month comes around every year, and it's kind of a month long that we celebrate dietitians and who we are and what we do as a profession and what we bring to, communities or to individuals. And so it was created by the Academy of Nutrition and Dietetics, who is kind of the, national organization of dietitians that we, that's who all of our continuing education and stuff goes through. So, but anyway, so every year they pick a different theme. So this year's theme is Celebrate a World of Flavors. And then each week within March, they kind of have a different topic or, sub-theme that they highlight each year.
So world of flavors. So maybe thinking about, different spices or different foods, trying new things.
Yeah. So, the first week, for example, they really hit hard about, it's important to eat a variety of nutritious foods. They talk about plan your meals and snacks, create tasty foods at home, and then, seek out a registered dietitian if you're needing that extra support. So they kind of go through those different weeks and hit those different topics.
So what are some of the common things you hear as a dietitian that make you go, ugh?
Oh, do I have to pick one?
I'm sure there's probably a long list.
Yeah, but pick your top 5 maybe. I don't know.
Well, everybody thinks I'm judging them for whatever they're eating all the time.
Sure.
Constantly. They're, whether
I shouldn't eat this in front of the dietitian.
Right.
Chips.
Right. So they'll be like, oh, I shouldn't eat this. I'm so bad. I know. Or they'll be like, I was really good yesterday, so I can have this. They're trying to justify it. And I'm like, what's wrong? Girl, eat it. I don't care. I'm right there with you. So I think that people just think I'm constantly judging them. Or they start judging me. They'll be like, oh, you're a dietitian. You don't eat that. We're going to have to plan a special menu because Beth's coming. And that's not at all the case. So I think that those are some of the things that just really, I want people to have a healthy relationship with food. And so when they start saying those things about themselves or, perceiving that about me, that I'm judging them, that's not at all what a dietitian is or does. So I think that's my biggest message that I want to get out to people is food is just food. It doesn't make you a good person because you ate quote good today, or a bad person because you ate, something quote bad today. So
right. Food has no morality.
Right. Exactly.
It is food.
Exactly.
This food isn't good or bad, that doesn't exist.
Yeah. Exactly.
Yeah.
Exactly.
as a dietitian, what are some of your resources that you rely on when patients, come in and they're looking for other information, they're looking for help? What are the resources that you use?
Yep, absolutely. So the biggest thing I can stress is make sure what you're looking up or using is evidence-based, right? So we want whatever you're doing to be supported right by research. And so that's what I think credible sources is the biggest thing. So as a dietitian, where I go for information is one, Academy of Nutrition and Dietetics. That's, kind of the mothership of the dietitians. That's who I go to for a lot of my patient education materials.
And as a consumer, that's eatright.org.
Yep, eatright.org, exactly. Thank you, Anne. American Diabetes Association, American Heart Association, and if you're just like, I don't have diabetes or heart disease, just Choose My Plate. It's just the, another website for if you just need general healthy nutrition, choosemyplate.org.
So what would be the top 5 things you want people to take away from a session with you? Or what do you think are the key messages you want the community to hear?
Sure. So, I think we kind of already touched on it, but that all foods can fit, right? A healthy, nutritious diet doesn't have to be complicated. You don't have to be tracking everything or calculating everything. And, I hear people, they're cutting out entire food groups, or they're counting every calorie that goes into their mouth, or they're like, oh, I'm not eating carbs because carbs are bad, right?
Yeah. Right.
So, it doesn't have to be like that at all. We were meant to consume food. Food wasn't meant to consume us. And so many people have just really gotten away from intuitive eating. And that's, kind of a framework that I'm really passionate about. And I talk to a lot of my patients about is, it's okay to allow yourself to have those things. Like, that is part of life. We should enjoy those things. Food was meant to celebrate and, stop letting it consume you so much. So, like I said, I really like the My Plate framework if you're just needing kind of general healthful nutrition. In general, Americans eat way too many carbohydrates and protein foods and not enough fruits and vegetables. So you'll hear me telling, like, eat more fruits and vegetables. I tell people that all the time.
Right.
Like, if you can do anything, you want to do something today, go eat more fruits and vegetables. That's something easy that people can get their arms around, and it's going to have a lot of benefit for you. And I briefly just mentioned intuitive eating, but I think that's really something that people have gotten away from. Learning how to recognize your hunger signals again. Like, are you really hungry? Like, do you really need that?
Right.
Or are you eating it because it's in front of you, or because you're sad, or
bored.
Or bored, exactly.
Or because it's a habit,
right.
So like every time I watch this TV show, I get my snacks
I get a
or
snack,
whatever.
right?
Yeah.
Eat my chippies.
Yeah. And I think, so last weekend I made chocolate chip cookies with my kids. And I try to make foods very neutral in our house. So we had it as a snack along with another more nutritious item, right? More nutritious than what a cookie was. But I offered them all along together because I don't want to put a cookie on a pedestal. And, that's something I think just in the stage of life I'm in with kids, like, I'm very conscious of how I talk to them about food because I want them to grow up and have a good relationship with food. So my boys, when they'd had a couple cookies and one of them left like 2 bites of cookie on their plate and the other one left half a cookie on their plate. And I'm sitting there thinking, like, who does that? Like,
right?
That's amazing.
Who leaves a cookie?
Who leaves 2 bites of a cookie? And they're like,
No.
no, I'm good, Mom. I don't want to finish it. But if if you think the reverse side of that, if that was broccoli and I was like, you have to eat that broccoli before you leave the table, right? What if I was like, you have to eat that cookie before you leave the table? Like, why do we talk about foods differently?
Right.
And why do we put them on different kind of pedestals or playing fields? And kids are really intuitive eaters. And, I think that we lose that because of our culture, maybe how you were raised. Are you a clean your plate club person?
Right. You don't want to be wasteful,
right,
etc.
right.
Yeah.
Yes. So I think just getting back to your internal hunger signals and respect your body, right? So genetics are a very real thing. Like, some people are like, I want to be my high school weight again. I'm like, that's not realistic. Okay.
Right.
So look at your mom and dad, look at your grandma and grandpa, and accept what your genetics are going to make you look like. I wear a shoe size 9. I'm never going to squeeze my foot into a shoe size 7 because that would be miserable, and I shouldn't expect that of my body either. Right. So, stop comparing yourself to others, and just, the whole diet culture is something I'm very passionate about, and just makes me cringe how it makes people feel.
Yeah, absolutely. I do think we see more and more positive influences in social media or other places that, we're getting better and better about that, about saying no to that diet culture and that idea that we could all eat the same food, we could all do the same exercise, and we would still have different bodies,
Yes.
and like embracing who you are as is,
Yep.
So progress, right?
Absolutely.
As moms, I think this is a common one. Kids who are picky eaters, like I'm sure every kid has probably gone through that phase of like they only eat like 3 things,
Chicken nuggets.
Chicken nuggets, mac and cheese, right? Or maybe they only have one vegetable that they'll do or whatever.
Yep.
So how do you, I mean, you're a mom, but you've got this extra layer of like, how do you handle this? What do you do with a picky eater?
Yeah, and I think this is something that I try to be very intentional with my kids about, and like by no means are my kids eating kale and stuff. Picky eating is certainly a real thing, but I think as parents we fuel that a lot of that by catering to them, or pressuring them at the table or whatever it might be. So, I really like, parents out there with kids. I really like the Ellen Satter Institute. She just has a really good kind of division of responsibility for parents and kids and whose job is to do what at the dinner table. And I think that that's really good framework for parents. If you want advice from a registered dietitian who's an expert in the area of kids, like that is a great place to go. And she has just a great website with a lot of different resources. But, as a parent, I get to decide what my kids are eating, when they're going to eat, and where they're going to eat. So what I'm offering, how often are they going to eat? Like when are meals? When are
so
snacks?
you're setting the meal plan. Yep. You're buying the groceries and you're doing the cooking.
And where are they eating? Am I letting them eat in front of a TV? Am I letting them, are we having family meals every night? So parents are responsible for that. And then my children are each responsible for how much they eat and whether they eat or not. So with little kids, I put food on their plate because I don't want them touching hot dishes and that kind of thing. So, but they don't always try everything on their plate. And I don't make them. I don't talk about it. But I model it as a parent. And so, there's another thing I'm pointing back to the parent. Like, are you modeling good behavior for your own child? So, are you trying the foods that you want your children to be trying? Are you offering a variety of things? If they don't like it, that's okay. We're not going to pressure them or, force them to eat it or bribe them to eat it, right? You don't get to eat your broccoli and then get a cookie, right? Like food's level. Let's put it on a level playing field. But, are we as parents being good examples? Are our phones away? Is the TV off? Are we having, genuine family conversation? Is the mealtime pleasant, a pleasant experience for the kids? And, maybe your kid's truly not hungry. Like I told you the story about my boys and the chocolate chip cookies. Like sometimes kids just are very in tune with their own hunger and they're not very hungry. And so they might only eat one food group at that meal, but it's my job as the parent to make sure that I'm offering, safe foods, but also, not being a short order cook.
So I'm thinking about trying the latest diet trend.
Right.
Tell me more.
Don't do it.
But why, Beth? Why?
All of the different crazy diets that come out, they typically have a couple things in common. One, they're trying to sell you something, whether it's a shake or a supplement or a meal replacement bar or something. So, like, if somebody's trying to sell you something, like, just don't, right? You can get everything you need, whether you're growing it yourself or getting it at the grocery store or the meat locker. You can get your food not from supplements and shakes and bars. So I think that's a big thing in diet culture right now. But then also all things that these diets have in common is they're restricting calories in some way, whether they totally pull out carbs or it's, pulling out a whole food group. You're missing out on really important nutrition that you need. So I always tell people, please don't do diets, unless it's medically prescribed for some reason, or there's a life threatening reason you can't have a certain food group, like a really severe allergy or intolerance. Absolutely cut that out. But for the general public, you don't need a diet. They're not sustainable. You can't do it long term. And if we can become, more, learn how to eat in moderation, get back to that, more mindful and intuitive eating, respect your body and where your weight's going to fall. And don't play into the diet culture. I know it's so heavy and it's really a force to be reckoned with, right? So, they're just so convincing in their ads and that kind of thing. But, everybody's the next best thing. And then, before you know it, you've spent, hundreds, if not thousands of dollars on products and that kind of thing. And it's just not sustainable long term. I often ask people, do you want to be doing this, 5 months down the road, a year down the road? When you're 80, do you see yourself doing this? If the answer is no, then maybe we need to find something that's more sustainable long-term for you.
Yeah. How do you get more fruits and vegetables into your diet? Like, what are some of your tips for people on, like, how do you start incorporating more if you know that's an area that you want to improve on?
Absolutely. And I think that's one of the biggest things. People are like, well, how do I do it, right? A simple thing, your lunch and your evening meal, half of your plate can be, vegetables, and you can add in a fruit then if you want to. So when you eat your lunch and your supper, do you have half of your plates that's fruits and vegetables? I think especially this time of year, I know I stock up on the microwave bags of vegetables because they're just so easy. I don't have access to my, garden
and they're in the
fresh.
freezer, so they're just ready to go anytime you are.
And they're 5 minutes, and I have, a good vegetable option.
And they're just as nutritious.
Yes, absolutely. And sometimes more nutritious, depending on the season that we're in, because, they're picked and processed very quickly and frozen. So those nutrients are maintained as long as we're not really overcooking them.
Yeah.
Whereas in Iowa, in the, middle of winter, we just can't get that fresh broccoli or Brussels sprouts or whatever it might be from our own garden. So I think the frozen options are great. Generally they're very reasonably priced. You can do canned as well. And sometimes people like to sneak them into recipes. Maybe I don't like the, sneaking things into recipes, right? Because that's a whole nother thing that I like to be honest about what I'm putting on the table in front of my kids so they're not surprised when they bite into something. But, last week I made meatballs and I put some shredded zucchini I had from my garden this summer into the meatballs. It made them really moist. The kids are like, oh, what's that? And I wasn't going to lie about it. I told them what it was and they're like, oh, okay, but you couldn't taste it. It added some more fiber. It made them more, moist and that kind of thing. But as a working mom, I always try to have a fruit on my desk because I know like mid-afternoon I start getting hungry and it's a while till supper. And if I don't have that, I know that I'm really hungry and it just leads me up to maybe eating too much at supper or eating things before I even cook my meal. And so I'll always have like an apple or an orange or, a banana, something easy on my desk that I can just grab in the afternoon. And then when I'm at home cooking supper, if people are really, really hungry and I'm not getting supper on the table fast enough, have a relish tray with some dip or something, Do you do this?
I do this.
Yes. Anne is queen of the relish tray.
I have multiple relish trays, and I do. I just look in the fridge, and I'm like, I've got some carrot sticks, I got some bell peppers, I got like one orange left nobody's had. I just cut it all up, and I put it out, and it
disappears. It disappears.
They totally eat it because it was already prepared for them. It's easy for them just to grab.
Exactly.
So, I do relish trays all the time. A couple cheese cubes on there, whatever.
I've started doing that, too, since she told me to.
It gets them off your back while you're cooking, so they're
and
not
it's a healthy option.
And it's a great option too. So it gets you some more fruits and vegetables before your meal. And then if I've eaten my meal and I'm still hungry or like I'm not quite satisfied yet, I go back and get another helping of the vegetables. And typically that helps. They're really good in fiber. It's going to help me feel fuller longer. So those are just some ways that I incorporate more fruits and vegetables into my day. Whether it's through things I'm cooking or just making it the easy choice. And like you said, when I go to the grocery store, I always come home, I wash things up, I cut things up, and I put it in my little containers because if it's ready to go, then I'm much more likely to grab that. And I'll even, for my husband that packs his own lunch every day, if I baggie up little carrots in Ziploc bags, he'll grab one of those and take it in his lunch. But if I don't, he won't. So got to make it an easy choice.
Yeah. And it doesn't take that long to do that prep for the week, know? Yeah.
Not at all.
So when should I seek out help from a registered dietitian? And will my insurance cover it?
Yeah, those are good questions. So, I think if I've been, through this talk and you're like, wow, I really maybe have some food issues that I haven't totally worked through, I think that that's definitely important for you to seek out, a healthcare professional to get a consult to a registered dietitian. Unfortunately, not all insurances cover it. Kat, to your question is, does insurance cover it? I wish they covered more. Generally, insurance will only cover if you have diabetes or chronic kidney disease, but that doesn't mean you shouldn't see a dietitian, right? So you will have to probably pay out of pocket. But if it's something that you need to make your life and, be healthier for you, I think it's absolutely worth the money. And I'm always willing to chat with people on the phone and send them some resources in the mail if it's just not not an option for them to pay out of pocket to see me. Mm-hmm. But I also like to make a note that, just like there's specialists and doctors, dietitians specialize in different things too. So, I'm just kind of like your general, doctor you'd see here. I'm kind of a general dietitian. I work with the basic population, mostly diabetes and chronic kidney disease, and a few other things here and there. But, if you're somebody who's really struggling with disordered eating and maybe you had a lot of struggles when you were a kid and those are resurfacing as adult, or you never worked through those and you never sought help from a younger age, there's dietitians that specialize in that. And I'm not afraid to say, hey, I got this referral. I think there's somebody else that might be better for you. I've gotten those with tube feeds before, home tube feeds. Hey, what do you think they should be on? At what rate? And I'm like, let me get you hooked up with a dietitian that does tube feedings all day long. So it's not that I can't do all of those things, but sometimes just like a doctor would send you to a cardiologist if you had heart issues, dietitians do that too. And we're good about referring to each other if needed.
Mm-hmm. And I need a referral to see you from my primary care provider. Yep. I can't just make an appointment with you, right?
Absolutely. I have to have the referral, just as, as any other specialty around the hospital. You couldn't just walk in and get physical therapy, right? You have to have a referral. So same thing with the dietitian. So just if you are interested, I think it's a good thing. Give your doctor a call and let them know, hey, I'm hoping to see the dietitian for XYZ, whether you have diabetes or kidney disease, or maybe you have a food allergy or intolerance that you're really struggling with, or you just want general help, with good, healthy nutrition. Let them know what you're wanting it for, and they're very good about putting in a referral, and I'll give you a call once it comes through.
Let's say I'm, coming to you because I want to lose weight. I want to improve my diet. That's my goal is, I've got that number in mind for the scale,
Exactly.
I bet you hear that a lot, actually.
All the time.
Yeah.
Yep.
What's the conversation that you have with a patient when they say, I've got to hit this number. I want to lose weight. What do I do?
Yeah, I think sometimes they come to me because they think I have a magic answer.
You
don't?
I don't.
Isn't there just a pill that I can take?
Yeah. Right. They're like,
or if I do this, I'll get this.
Yes, right. So, nutrition is not that black and white. And, kind of how I talked about genetics play a lot into, our weight and our, overall health, whether that's our cholesterol or, if we develop diabetes and that kind of thing. And, of course, nutrition plays into that as well. But, I just have a really honest conversation with people about, what has your trend been over the years? What's changed recently? What are some things you're willing to work on? Because I could tell you suggestions all day long, but if you're not willing to work on things or make changes or, add things, we're just going to kind of be stuck where we are. So a lot of it's just getting patients to try and respect themselves and their situation or where they've come from. And when it comes to weight loss, weight loss isn't a bad goal, but it's, maybe it's, yes, weight loss is your overall goal, but maybe it's because, I want to feel better. I want to be able to run around with my grandkids. I want my cholesterol to look better, or, my dad died of a heart attack at a really young age, so I want to work on my heart health. And so I help people try and see past just the number on the scale or what pants size they're wearing. What's the root cause of why you want this? Those are better goals that we can work on, or sometimes more motivating than just a number on the scale.
I never know what to cook for dinner. The plight of a young mother. Or any mother or anyone.
Yeah. Anyone.
Yep.
Right? Like, what tips and tricks do you have for folks when it comes to getting something on the dinner table?
It seems like they want dinner every night.
Yeah,
right?
Weird. They want to eat.
And nobody else cooks it.
Yeah.
Yeah.
What's with that? I think the biggest thing that when it was just Jared and I before we had kids, like, it didn't matter if we ate at 7 or 8 o'clock, it's like, whatever, I've got, hours once I get home from work to prepare this fancy meal and try a new recipe. And that looks so different now in motherhood, especially with, young kiddos. I'm like they want to be in bed by 7, so it's like, I can't start cooking at 7. So my meals are no longer, fancy and, this big elaborate plan, but there is a plan. I go through phases, I think, of, a really thought out plan where I'm like, here's what I'm cooking for the week. And others I'm like, okay, like in this phase of motherhood that I'm in right now, I'm like, what am I cooking tomorrow? And, it's not always fancy at my house, but I always try and make sure that I'm offering all 5 food groups. And like I said earlier, do I have some of those safe foods that my kids are comfortable eating? They're going to be offered everything, but do I have some foods that I know that they feel okay about? If I put on their plate just a random pile of food that they've never seen or touched or experienced before, they're immediately going to put up their walls. So, for example, tonight I've got to be somewhere. And so I know that I need to have supper cooked, dishes done, and bath started in order for things to go well and for me to get out of the house in time to be somewhere at 6:30. So tonight it's going to be whole wheat bread, fried egg sandwich. So, I'll scramble some eggs, throw a piece of cheese on there, and put out, whatever fruit or veggie I have left, and the kids will have milk. So, I hit all 5 food groups. My kids love that meal. It's good protein. They're getting tons of fiber from the fruits and the vegetables and the whole grain, and I know they're getting the calcium they need from the, the dairy and the cheese. Mm-hmm. And so sometimes it's just something super simple like that. But I always try to have a plan. And then, I shop from whatever's on sale at the grocery store. I'm not buying the expensive meal kits that come to your door. Mm-hmm. You can do that if you have the means to do that and the time to do that. Absolutely. But make it easy. You don't have to make this huge elaborate meal. You asked what I'd cook at the beginning. Yeah, we would love lasagna, but probably on a Sunday, right?
Right. Yeah.
Yep. Right. So, I tend to cook bigger quantities of meals because then Jared and I can take it for leftovers the next day. Again, making that healthy choice, the easy choice instead of, I don't have lunch. I guess I got to go drive through somewhere. And so we'll either eat leftovers the next day, or if there's enough of it, I'll freeze it. And so then another night when I know I don't have time to cook or I don't want to cook, I can pull that out. And I know that I've got a meal that I can just reheat and, maybe throw in some extra fruits or veggies on the side, and there's a meal. So it doesn't have to be complicated, but I think if you don't have a plan, it's very hard to succeed.
Beth, thank you so much for your time today. I think you've given us a lot of great information and useful tips that we can use.
Excellent.
So thank you so much, Beth.
Thanks for having me. It was fun, girls.